Hi, this is Megan Coe from the King County Auditor's Office. Thank you so much for your interest in our audit work. I'm going to walk over a couple of key takeaways, a little bit about this audit scope for this audit of DCHS contract management. DCHS, if you're not familiar, stands for the Department of Community and Human Services in King County. I'm going to get started now and spend a couple slides on what we audited, and then I'll move on to what we found. Within DCHS contract management, we reviewed a sample of locally funded community grants. These are funding for services that primarily benefit people in the community. So that's what distinguishes community grants from contracts generally. And what we wanted to know was how well these grants were being used, how well the payments aligned with rules established in county contracts, policies, and best practice. We looked at a number of contracts, and this slide summarizes it in quite a bit of detail. So I'm going to start on the left here. This lists the 4 programs that we looked at. 2 of them circled here are juvenile diversion programs. And in addition to that, while this program is not uniquely or only juvenile diversion, it does include one contract that is referred to as theft-free and mall safety. Moving on to the second column, our sample had a combined total of multi-year budgets of about $34 million over about 2 years. And this encompassed a total of 36 contracts that were in our sample. And the last thing I want to point out here is that we did look at local funding. So no federal funding, but there were a variety of local funding sources, including multiple Best Starts for Kids funded programs. Now that we've talked a little bit about the scope of our audit, I'm going to lay out 3 findings that I'm going to cover in this presentation. The first is that DCHS has not prioritized responsible stewardship. Secondly, DCHS made improper payments that show that there were opportunities for fraud, waste, and abuse. And the third and final takeaway is that DCHS did not effectively meet grantees' needs for financial management training. So starting with the first takeaway, it's important to note that DCHS and the county as a whole had a goal to reach smaller organizations with human services funding. These organizations, being smaller, would have less funding and fewer staff. And a 2023 Best Starts for Kids report noted that grantees needed financial management training and support. More broadly, beyond Best Starts for Kids, and looking at the hundreds of grantees that DCHS reviewed in 2024, it did a risk assessment of these grantees and found 48% as high risk. High risk, if you look at the rubric DCHS uses, included these things we've talked about, such as limited government funding experience and fewer financial staff. So what we can find here is that DCHS delivered on the goal of spreading human services funding more broadly. But our real focus in the audit is that it did so while providing limited oversight. So to say more about the delayed oversight, I'm going to talk about 2 things. First, DCHS rarely did financial monitoring. DCHS refers to this monitoring as fiscal site visits, and these visits can be either in person or they can be virtual. Site visits are important because they help DCHS identify where grantees might need support, and they also help to prevent and detect fraud and noncompliance. What this means is that the earlier site visits happen, the sooner DCHS can support grantees and resolve any contract management issues. So DCHS has its own policy, and it set its own standard for how often these site visits should happen. It decided that they should happen at least for at least 1/3 of all grantees each year. So in any given year, it should be reviewing about 120 grantees. And we found that DCHS did not meet its own standard of 1/3 of grantees reviewed. And in 2022 and 2023, the particularly low performance had to do with turnover, difficulty in hiring and retaining employees that worked on the team that conducts fiscal site visits. In 2025, DCHS is expecting stronger performance because it has allocated 3 new positions to this team. However, you should note that 2025, since it is not yet a completed year at the time the review was conducted, that this includes visits that are scheduled, while other years are limited to completed site visits. So I'm going to give one more example in addition to fiscal site visits of limited or delayed oversight, and that is the hybrid payment model. So just a little background, this was developed by DCHS and Public Health for the Best Starts for Kids levy. And one of the main elements you need to know is that it uses set monthly payments that are based on contract budget instead of actual spending. So in other words, if a contract has a 12-month budget for a total of $120,000, that set payment would be $10,000 per month. Now, in terms of scope, or scale rather, DCHS spent more than $130 million using this model in 2024. So, like I said, the point here is that the hybrid model delays oversight in 2 ways, and we're going to look at this compared to a cost reimbursement model. So first, it delays reporting from monthly to quarterly. So cost reimbursement requires monthly spending reports because DCHS only pays or reimburses grantees for how much they actually spent providing services. Because the hybrid model doesn't do this, and as I mentioned before, sets monthly payments based on the contract instead, DCHS only requires grantees to submit expense reports quarterly instead of monthly. The second delay from the hybrid payment model comes at true-up, and that's when DCHS actually does compare the budgeted contract payments to the grantee's expense reports. Obviously, under the cost reimbursement model, this happens with the first payment when they're doing the expense report review. But under the hybrid model, the true-up or reconciliation is delayed to the 12th payment or second year of a 3-year contract. What this means is that payments in excess of actual expenses can build up over time. We found one case where a grantee received $80,000 more than it had spent on youth services before DCHS had paused payment. So we made several recommendations to address some of the elements of this first finding. We recommend that DCHS ensure staff are supported in fiscal monitoring duties, that it thoroughly identifies and addresses the risks of the hybrid payment model, and develops clear, consistent processes for managing excess payments. I'm going to move now to our second of 3 key takeaways, and this is that DCHS made improper payments. Improper payments here mean that DCHS made payments that either went against contract rules, were for expenses that lack sufficient documentation to show they were relevant to youth services being provided, or otherwise overpayments. The examples that we found included one grantee whose supporting documents were cash withdrawals, 2 grantees who likely altered or forged supporting documents, which may meet the definition of fraud under county policy, 3 grantees whose spending deviated significantly from their budgets without written approval or amendment, and 6 grantees who were paid without consistently submitting detailed expense reports. These and other payments took place in part because DCHS did not have written policies and procedures or robust training to inform staff how they should be reviewing and approving expenses. DCHS is currently reviewing these and other improper payments to see if it needs to recover any funds or take corrective action. Based on these improper payments, we recommended that DCHS document standard procedures for invoice review, enforce contract terms related to financial reporting and contract amendments, and provide staff with training to prevent and detect fraud. Our third and final finding is that DCHS did not effectively support grantees in the development of their financial capacity. We discussed briefly that DCHS has not done enough site visits to help grantees identify areas for improvement, that it has delayed financial reporting under the hybrid model. This finding now focuses on the Best Starts for Kids capacity building program, which offers free consulting services for organizations with grants from this levy. What we found here is that though there is demand for financial management training among grantees, of the nearly 23,000 total consulting hours provided by the program between 2022 and 2024, only 6% of these hours were for financial capacity building. Staff speculated that this was because the program lacked consultants with financial expertise, or that smaller grantees lack the time to work with consultants in addition to providing services in the community. As a result of this finding, we recommend that DCHS find ways to better meet the financial management needs of grantees, including through more guidance and communication about contract requirements. To recap the findings we discussed today, we found that DCHS did not prioritize responsible stewardship, resulting in limited oversight of community grants. We also found multiple examples of improper payments, including potential fraud. Finally, we found that DCHS did not effectively support grantees with financial management training, increasing financial risk to the county and grant recipients. DCHS needs to put thorough contract management processes in place to ensure that public funds are spent as intended in service of the community. Thanks again for your interest in our work on government accountability and oversight here at the King County Auditor's Office. To learn more about this and other reports, please visit our website with the URL listed here.